Good afternoon, everyone, and welcome. I'm Scott Leitz, Vice President at NORC at the University of Chicago. Funded by the Robert Wood Johnson Foundation, the NORC Medicaid Managed Care Organization Learning Hub is committed to providing information on ways to address health equity and transform healthcare with a focus on managed care organizations, consumer groups, state Medicaid leaders, and other stakeholders. In bringing you today's webinar, I want to acknowledge the key contributions on this topic of our lead partner, Spire Healthcare Strategies, LLC, and our key partners on this project, America's Health Insurance Plans, Association for Community Affiliated Plans, Community Catalyst, and Families USA. The role of stable housing has come into focus as a key social determinant of health for improving the health of Medicaid members. With recent investments in affordable housing and housing supports for Medicaid members, today's webinar will highlight some of those initiatives and successes. Before we get to the agenda and speakers for today, I wanted to note just a couple of logistical things. First, all attendees will remain on listen-only mode, but please do send us your questions using the chat box, and we'll get to as many as we can during the webinar. You can also find the slides for today's presentation on our Medicaid Managed Care Organization Hub website listed at the link on the slide. During today's webinar, we'll hear presentations from housing experts at UnitedHealthcare, CVS Health, and CareSource, who will discuss their housing investment goals, funding strategies, and community partnerships for providing support to affordable housing. After presentations from each of our managed care organizations, we'll have a facilitated discussion and then use the last 10 to 15 minutes of our time today to turn to audience questions for the presenters. I'll introduce our three presenters in the order that they will be presenting today. Our first presenter today will be Andy McMahon, Vice President for Policy, Health and Human Services at UnitedHealthcare Community and State, where he focuses on integrating and leveraging affordable housing and human services to provide better care at lower costs for populations with complex health needs. Andy was previously a managing director and then vice president at the Corporation for Supportive Housing in Minneapolis, and before that held positions in state and local government. After Andy, we'll hear from Kelly Savage, who is the head of Impact Investment Strategy at CVS Health, where she is responsible for leading the strategy across all CVS Health and Aetna lines of business in coordinating and in continuing to build on the over $1 billion of affordable housing and community investments made by Aetna, a CVS Health company, in the past 20 years. Prior to her current role, she served as Western Region Head of Real Estate Investments and co-manager of the affordable housing portfolio at Aetna. Kelly began her career as a certified public accountant at Deloitte after earning her BS in accounting at the University of Connecticut. Finally, we'll hear from Amy Regal, who is the Director of Housing at CareSource, where she is focused on creating innovative and sustainable approaches to integrating housing and health. She is focused on building collaborative partnerships to address affordable housing through development, financing, and policy with an emphasis on improving health outcomes. Previously, she was the Director of Job Connect Ohio at CareSource, leading the effort to assist Medicaid members in removing barriers to high-quality employment opportunities. With that introduction, can I turn it to you, Andy, to kick us off?
Absolutely. Thank you, Scott, so much for the introduction, and really appreciate the time and look forward to the conversation today. So as Scott said, Andy McMahon from UnitedHealthcare Community and State, which is the Medicaid part of our organization. Next slide, please. We, UnitedHealthcare Community and State, has the privilege to serve over 6 million members. You can see kind of in the various Medicaid programs, but we operate in 30 states plus the District of Columbia, serving those 6 million members, just to give you a sense of kind of the breadth geographically and the various populations within Medicaid we serve. Next slide, please. So I'm going to give you guys a brief overview this afternoon of our housing and impact investment strategy. And I think, just to be clear, I think these are rooted in some of these core things that I've outlined here, that kind of acknowledging the enormous role that affordable and supportive housing and community-based organizations play in providing services and housing and care to our members. And so our efforts are kind of rooted in that understanding, and then thinking about how then can we deploy resources from United Health Group in support of those housing organizations and other community partners. Next slide, please. So we have, when we set out to do this, we developed kind of 4 pillars of areas that we were looking to advance and make investments that you can see here. I think what I would flag for you is that kind of the largest part currently is certainly around the affordable housing creation and preservation. And I would also just highlight the interconnection between housing and all of these 3 other efforts outlined. I think in our experience, all of these efforts are totally intertwined, and the fact that sometimes they operate in silos is the challenge we have. And so thinking about how do we make kind of investments in housing and cross sectors to both address affordable housing needs that individuals have, but also then the array of other things that they need to lead a healthy life. Next slide, please. So we have developed, to give you all a quick overview, and then I'm going to real quickly do a couple of examples, but we launched last year a $150 million social impact investment fund, where we will be providing both equity investments, below market loans, as well as focusing on outcomes-based financing mechanisms. So these will be kind of the mechanisms that we are using to deploy the capital. I think really importantly, right, these are not grants, they're actual investments in housing and other things. And so kind of core issues for us are return of principal, but I think really importantly what I would highlight is our, I think, enormous appetite for conceding interest rates and on returns, because our idea in terms of like those below market loans is to provide what I would call kind of catalytic and concessionary capital to make housing deals and developments pencil out that might not otherwise pencil out. So that second bullet under key issues, I think, is the core piece of it. And you'll also see there that we're also interested and focused on where we can pair social impact investments with tax credit investments. So I'll highlight it in a couple of minutes here, but so far we have made over $500 million of investments in low-income housing tax credits. And so now as we look to the future, we'll hear about our new fund and then how we can also leverage the social impact fund to create more housing as well. Next slide, please. So I'm going to give you a couple of examples. I feel like a lot of times you could talk at the 50,000-foot level, and it's kind of like, okay, Andy, but what are you guys really doing? Like, what are you investing in that's making a difference? This is a effort called Just in Reach, which is a Pay for Success initiative. It's a partnership that we have with Los Angeles County and the LA County Jail. And we were the senior investors, providing about $8 million in capital. And then we partnered with the Hilton Foundation locally in LA to provide the financing for this project with the goal of ultimately getting more than 300 individuals who have been cycling off of in and out of the LA County Jail and the streets of Skid Row for years, if not decades. And getting them into safe, decent, affordable housing with the supports they need. So that's just one example on those mechanisms I mentioned around outcomes-based financing. Here's a specific example where we invested $8 million and we'll get more than 300 individuals into housing, and the return on our investment will be based on the metrics and the success of the initiative. Next slide, please. The second here is an initiative that I still thought was worth highlighting that we did with TIPQC in Tennessee, working to address opioid use disorder and improve the health of pregnant women and then their newborn babies. And so it was an investment to increase adequate prenatal care, and I know you talked, but also kind of ensuring that the moms and kids also have a safe, decent place to live, and so that we're providing kind of the holistic care and supports that they need so that we can have healthier moms and healthier babies as well. Last slide, please. I think it's last. So, and I'll spend maybe an extra minute here. So we, last March, actually right around the time COVID hit, we launched a $100 million health and housing fund with our partners, SAFE, Stewards for Affordable Housing for the Future, and NAHT, National Affordable Housing Trust. SAFE is the association of about 30 of the kind of best and brightest nonprofit housing developers in the country, and NAHT is their kind of tax credit syndicating agency. So we made this $100 million commitment, but we wanted to make sure that we were kind of evolving our approach in how we invested in housing and try to align it even closer to healthcare. And so I'm going to give you a little sense of how we're doing that, but also I'm delighted to tell you guys that we announced this less than a year ago, and we have fully executed commitments on, I think, $108 million, and we're going strong. So this was kind of a fund we created and pledged, but I can assure you the pledge has been exceeded after 1 year. So you can see a number of the projects that we have invested in the graphic to the right. But I think as we were thinking about launching this $100 million fund, I worked closely with our treasury team and wanted to make sure that while we desperately need more affordable housing all over in pretty much every community in the country, so we need affordable housing, period. But we also wanted to make sure that we were targeting our investments in a few different ways. And so the kind of differentiators, if you will, of this health and housing fund are probably threefold, I think. One is, while we absolutely know there's a need for workforce housing and other housing, all of our housing will be focused on serving kind of the most vulnerable populations, people experiencing homelessness, people with disabilities, extremely low-income seniors, extremely low-income families, et cetera. So we have a focus there. Every single project that we are investing in will have some connection and alignment or integration with health and social services. So we will not, forever now, invest in anything that is affordable housing that doesn't have some connection to healthcare. So that could look like on-site services. That could look like an MOU with a federally qualified health center down the street. It could end up being retrofitting and creating a exam room in what is an unused community room in the affordable housing. But every project will have a clear connection and integration between housing and healthcare. As part of the development, we also invested $1 million in grant funding to support and kind of spur some of the health and social service innovations in the housing. So again, how that money gets used will be determined by SAFE and developers with approval from us, but we haven't not approved a single one yet. And again, could be helping to pay upfront costs for service coordination, paying for an exam room, paying for Wi-Fi and internet capabilities to expand telehealth. So it could be lots of different things. And then the final thing I'll mention is that we are also working then with SAFE, again, Stewards for Affordable Housing for the Future. They have developed a housing as a platform tracking tool that measures resident health outcomes. And so we were really excited about that. So over the next few years, we will be measuring the impact on their resident health that being in safe, decent, affordable housing with connection to services has, what the impact is. And so finally, I think the thing to be really clear on too that everyone should know is that all of these investments, both this $100 million fund and our social impact investment fund, are made in a 100% plan agnostic way. So our UHC members may benefit, they may very well not. And that's fine. These are meant to be kind of investments in our communities and in the people and places where we all live and work. And so none of this work is specific to our members, but rather is meant as kind of investments in the community writ large. And as I mentioned earlier, so this $100 million investment that we did now pushes us over the $500 million number in terms of our overall investment. So, Scott, I think I will stop there. Hopefully I didn't go over or too much. I think hopefully that gives you a sense of kind of the various mechanisms, financial mechanisms that we're using to finance housing, and then also the various ways that we're then deploying that, whether it's through creating housing developments, creating permanent supportive housing in Los Angeles, et cetera. So I think, oh boy, I got to check and see. I apologize. I'm trying to see who is next here.
Andy, I can take it from here. Thanks for that great kickoff presentation. Kelly, can I turn it to you to tell us a little bit about the work at CVS Health?
Sure. Thank you so much, Scott. I'm very happy to be here today with everyone. The decision to bring Aetna and CVS Health together in late 2018 set the stage for our company to be in a position to transform healthcare for consumers. Being a leading managed care and pharmacy benefit management company, combined with having close to 10,000 local touch points within 3 miles of more than 70% of the U.S. population, we built a uniquely powerful platform that is allowing us to reshape the consumer healthcare experience. At CVS Health, we share a single clear purpose, helping people on their path to better health. In early 2020, our corporate social responsibility team announced Transform Health 2030, our new strategy to impact the health of the people and communities we serve, as well as support the health of our business and planet. This approach conveys our mission to effectively utilize our scale, expertise, and innovative spirit to transform the healthcare experience and invest in community health at the local level. Affordable housing combined with services supports all 4 pillars of this strategy: healthy people, healthy community, healthy business, and healthy planet. As you're all very much aware, affordable, stable housing is a key to a person's health. When people have access to high-quality, affordable housing, it puts them in a better position to manage their overall well-being, including taking care of their health and managing a chronic disease. Since inception, Aetna has been making affordable housing investments for over 2 decades. By the end of this month, we will surpass the $1 billion mark in affordable housing investments alone. We are proud to have invested in more than 1,100 affordable housing communities, helping to build or preserve nearly 100,000 units and positively impacting hundreds of thousands of lives. In terms of our Medicaid business, we serve more than 2 million Medicaid members across 16 states, denoted with the yellow dots on this map. As mentioned before, but particularly in the Medicaid space, the combination of Aetna and CVS Health is transforming the consumer experience and building healthier communities. Our total integrated care management includes physical, behavioral, and social supports. We have local plans with local employees and investments, and we are solving health disparities in partnership with our clients. During 2020, CVS Health closed commitments to invest $114 million to construct or rehabilitate more than 2,800 affordable housing units in 30 cities across 12 states, including homes specifically designed to provide permanent supportive housing and meet the needs of seniors and veterans. We did this primarily through equity investments, but we are also looking at other ways to invest, including some of the mechanisms Andy mentioned, like the low market loans and outcomes-based financing. In fact, in 2020, Aetna and UnitedHealthcare came together and each pledged $15 million of debt financing to the Home Matters to Arizona Fund, a $100 million fund leveraging government, philanthropy, national private investment, which was created to address affordable housing needs at scale adding critical housing units to a system that has left far too many unsheltered, while broadening the mindset of housing developers beyond the four walls of a home. I added this slide in for those of you unfamiliar with the low-income housing tax credit structure. Equity investments are made in exchange for tax benefits. There's a 15-year compliance period, and as with any investment, there's risk of loss, and in this case, a lower return on investment. But we believe strongly making these investments is the right thing to do to improve the health of our members and customers, as well as the communities in which we live. CVS Health and have been combining local community resources, programs, and services to meet the needs of all the people we serve, including the more than 23 million medical benefit members, 100 million pharmacy benefit manager plan members, and the 4.5 million customers served by CVS stores daily. The same is true with our increased investments in affordable housing. We look to invest in locations where there is critical need and where we can have the most impact. We are combining the investments and programs to help address social determinants of health and improve health outcomes, not only at the properties in which we invest, but oftentimes across the developer's greater portfolio of properties. Some examples of this include our new Health Hub store concept. With close to 1,000 currently open and 1,500 expected to be fully operational by the end of this year, Health Hubs offer a variety of services to help improve health outcomes and transform the consumer health experience at the local level, including managing chronic conditions, supporting nutritional health, and providing community wellness. We also have our Project Health program. This program offers free biometrical screenings to help identify chronic conditions before they become life-threatening illnesses. They're worth over $100 in value, and screenings measure body mass index, blood pressure, glucose, and total cholesterol, and are followed by professional consultation and resource guidance. This program, which has historically been offered at CVS pharmacy locations in select cities, will expand in 2021 with 4 new mobile RVs to focus on areas with higher populations of uninsured or underinsured people, with many on-site events planned for affordable housing communities. We also have our Workforce Initiatives program. The Workforce Initiatives team is focused on empowerment, education, training, and building local relationships, and they are being introduced to many of our affordable housing community owners to help residents achieve meaningful employment opportunities. Our Analyze, Rethink, and Transform program focuses on solutions for organizations with many low-wage workers who are all too often disproportionately impacted by chronic disease. Using a new analytics tool, we're creating the way for nation's employers to quickly identify and quantify the impact of their highest priority health disparities, and then looking for ways to help them implement solutions, including access to affordable housing. We have many other examples, too, including food insecurity, maternal care, nutrition and cooking classes, substance abuse, and senior social programs as well. Many of the programs I just mentioned are deeply entrenched within community-based organizations already. The difference now is there's a specific focus to offer more to the affordable housing communities. We are combining our efforts with developers, nonprofits, government agencies, providers, and vision-aligned companies to continue to deepen our community impacts. These impacts include providing housing stability, health outcomes, economic security, lower health expenditures, as well as community benefits. The reason I'm so proud to work for a company that truly cares, and I'm passionate about the work we do in this space, is the profound impact we have on people, one person at a time. This is an example of a recent investment that encompasses many of the things I've talked about during this presentation. I appreciate your interest in learning more about our affordable housing investments, and I look forward to answering any questions you may have. Thank you. And with that, I'll turn it back over to you, Scott.
Great. Thanks so much, Kelly. Amy, can I turn it to you to give us some insights into what you've been up to at CareSource?
Yes, thank you, Scott. I appreciate it. So hello, I'm Amy Regal, and I'm the Director of Housing at CareSource. So CareSource, I guess we could say, is the small but mighty one in this conversation. We're a nonprofit managed care organization that serves 5 states with now just about 2 million members, with the vast majority of our membership in the Medicaid program. And so over our 30-year history, we've had a commitment to our nonprofit mission and mentality of really keeping our members at the center and finding ways to be innovative in the space of helping our members to achieve the greatest health and overall well-being. And so as we have evolved, we have a division within the company called Life Services. That's where my position sits. And Life Services is our approach to addressing the social determinants of health and how we can help our members holistically to address social barriers and improve health outcomes, but overall just improve their life and their vision of their future. And so as we created Life Services, one of the things that we knew is at the federal level, there's many programs that help individuals who are low or moderate income, and they're targeted to providing assistance or other benefits to individuals. But as you'll see on the screen, this is a super complicated methodology, and it's very hard to navigate. And so we wanted to kind of clear up that white space, kind of fill it in and help people navigate between all these bubbles and all the different programs, whether you're talking about housing in the pink or health in the orangish tan or education or food, whichever one. We wanted to make this more of something that people can navigate. And that was always a goal. But what we also realized as we were moving through this is that there are different strengths and different skill sets that come out of each sector and how they address the needs that are at hand. And so how could we borrow from the different sectors and use those lenses to see if there were ways that we could help or that we could fill gaps within another area. And so as we kind of take a health lens and look at housing, we found many different ways that we could be involved, but an important way was in being able to make financial commitments. And as we approach our members, we do take this integrated care model where we're talking about pharmacy, we're talking about our life services program, care management, behavioral health. So we're putting all this together and looking at how we work with our members from this full picture. And what we know is that each area is heavily dependent upon having those basic needs met for the individual. And so if a person's housing is precarious, then all of these areas will also be unstable. And so how can we help to make sure that those key foundational elements are available when a person is navigating our health system? So we did about 2.5 years ago, we really decided to stand up an effort directly related to housing. We set out goals. Our financial commitment is not the only goal that we have. We also work on policy reform. We develop partnerships, and we work within pilots. But we wanted to find what those financial tools were that we could utilize. And this is a little bit difficult in the beginning because we are a nonprofit. We don't buy tax credits, which is the way that many companies within our industry participate in this area. And that was not a lever that we were going to be able to pull. So we started looking around the company to say, what were the advantages that we had? What were the things that we could lend into this area? And what were the gaps within the housing financing industry also? And so we started out utilizing a membership that we had to the Federal Home Loan Bank of Cincinnati. And as a member, we could participate in some of their community programming. We decided to partner with the bank and start looking at how we could pull down funds through those programs. As we were learning about that process, there was a tornadic event in Dayton, Ohio, which is where our headquarters are. And the Federal Home Loan Bank of Cincinnati has a program that helps for disaster reconstruction after a natural disaster. And so we were also able to start participating in that program, something we never expected to be able to participate in, but was a very important tool to bring down to our community in that circumstance. And so by learning things through the Federal Home Loan Bank and that membership, it was a very low risk way of learning more about how housing development occurred, about community-based organizations in the field, and also just to see, as we were participating in the development loan program, more about capital stacks and what the risk of an affordable housing project really was. And so those efforts led us to looking at how we can make commitments and investments into affordable housing. And when we decided to look at this, we looked across all of our markets and all the cities. The 4 things that I have listed here are all based upon Columbus, Ohio. But the truth was, often the question comes up is, where do you focus your investments, or how do you pick which geography or where to place your money? And what we saw was that this is really a problem that's impacting the entire country. That this isn't an LA problem or a New York problem. This isn't an urban problem or a rural problem. This really is something that is in every aspect of the communities that we serve. And so if we were going to think about this, we had to have an approach that could speak to urban projects or developers working in urban areas as much as it was speaking to rural communities or states that were underserved within the development of affordable housing. So we really kept these facts about what it felt like for our members at the core of what we were doing. And what we wanted to move the dial on was having these numbers, having these statistics be different in the long run for our members. The more of our members would have access to housing, the more of our members would be able to afford the housing, and that less of our members would experience homelessness in their life. So we keep that as kind of our North Star as we move forward. And as I mentioned, we have programmatic efforts. And one of our programmatic efforts was a project, it's a research study in Columbus, Ohio called Healthy Beginnings at Home, where we're looking at the connection between rental assistance and healthy birth outcomes. And in this project, it was a randomized controlled study, so 50 women in an intervention group, 50 women in a control group. And we saw from this that the women in the intervention group were more likely to have healthy birth outcomes, that they were 60% less likely to need NICU stay, so there was a significant reduction in the per member per month costs associated with those who participated in the intervention group and received rental assistance. And as we share this program across the state and across many different venues, people were always saying to us, like, okay, this is great. We don't need to wait until the final report. Like, let's go ahead and scale this. Let's make this bigger. Let's keep doing this. And one of the things that we knew was that we struggled to find 50 women housing in Columbus, Ohio, which is a very emerging market that is very much in low supply and high demand. And so we thought, like, even if we could scale this to 100, 200, 300, 1,000 women, that there just wouldn't be enough housing units. And so we became an investor in a fund in Columbus, Ohio. It's called the Housing Action Fund, and it invests in the development and preservation of housing units in Columbus. We were just a small investor in this $100 million fund, but it's already helped to fund over 10 projects, including the one that was mentioned earlier, Rosewood, in a very distressed area of Columbus. And so making investments like that, we see how the investment builds more housing, it improves the community, but it also makes it possible that we can address really important issues that we know have a very dramatic impact on our health, our members' health and well-being. And so as we thought about that project, we decided in August, so we're kind of the newbie in this world, but never think it's too big to get started. Taking little baby steps, I think, is exactly the way to go. And so in August, we made a $50 million commitment across our 5 states to invest in affordable housing. development and preservation. And as Andy said, these are loans, and so we do look for them to be repayable. And we are looking for measurable health outcomes. We're looking to engage strong partners, so we don't want this to be transactional. We want this to be a collaboration and a partnership that's built between our two organizations. And we're also looking for a term that's a little bit longer. And as we think about geographies, once again, this is hard for us to narrow down because it's just as much rural as it is urban. It's big city, small city. It's very diverse, but we want to make sure we're hitting all of those key areas. And so our investments made to date range everything from the Housing Action Fund that I talked about earlier, which is investing in tax credit projects for gap financing or the other types of development of new housing. But we've also invested $5 million into a fund in Cleveland, Ohio, that will actually help make rental units within Cleveland, Ohio, lead safe. And so there's a mandate in Cleveland that all units be deemed lead safe by 2025. And this loan pool will help landlords to be able to make those improvements and make those modifications, hopefully without passing on any additional costs to the tenant of the unit. So this loan pool is going into effect here very soon, and as a part of a larger effort to roll out this lead safe commitment there. So that is a very brief synopsis of the work that we're doing here at CareSource. And we are, we're, like I said, small but mighty, and we're new to the game, but I think making very significant strides in moving forward and helping to move the needle with affordable housing and the impact on health of our communities broadly.
Great. Thanks, Amy. And thanks to all of you for these really great presentations. You all are doing a lot here, and you captured it really well and in a concise way in your presentation, so it's greatly appreciated. You all are doing some really interesting and very, I would say, kind of complex work in some ways. And as we move into sort of some of the discussion as a next phase here, I wanted to pose an initial question to y'all related to the work that you're doing and related to the process that you went through to sort of start down the road of doing this work. And in particular, I'm curious about barriers that you or hurdles that you encountered along the way. Maybe if you all could identify what some of those larger hurdles were in bringing up this work and moving it forward. And as you do that, I'd also be very interested in hearing a little bit about whether there were any regulations either at the federal or state level that presented a hurdle as well for these investments that you're making in supporting Medicaid members' housing needs, and how you were able to sort of work with them and overcome it. So question is, what were your largest hurdles, and were there any kind of regulatory barriers that you had to work with along the way, and how did you kind of work with those? Andy, could I ask you to start on that question?
Sure. I think, yes, I think in terms of kind of largest hurdles, I mean, I think one is kind of, especially the extent to which we are making investments in low-income housing tax credits, or there's also new market tax credit programs, and now there's opportunity zone tax credits. So I think, Scott, a main challenge, and I feel like we're there now, but it probably took us a long time, is the low-income housing tax credit program is appropriately regulated heavily, and there's a whole set of statutes and regs, right, that you don't need to understand every nook and cranny of it, but in order to understand the risk related to it, you do need to understand the reporting requirements, the income requirements, and all sorts of things. So I think that, as a health insurance organization and health services organization working with our Treasury team, there was definitely a learning curve of understanding kind of just the regulatory and statutory rubric within which these programs are governed, and making sure that we could do that. So I think that was substantial, and I think related to that, right, the way some of the, especially like the new Opportunity Zone program is set up is, I've been asked about it dozens of times, and the program, once you understand it, the program is really more for like kind of high net worth individuals, and that's fine, but that, so that program is not necessarily one for institutional or kind of corporate investors like ourselves to do. One other thing I would mention, Scott, on the challenge side, but we hopefully turned it into an opportunity, is that we ended up creating our social impact investment fund because in a positive way, but there's a pretty healthy market for the low-income housing tax credit program. So our chief investment officer came to me 2 years ago and basically said, Andy, there's got to be something else we can do. I'm happy to continue to do low-income housing tax credits, but and I'll just be candid, you guys, right? The reason why we created that fund is that if we didn't buy those credits, somebody else would, and that housing would get built. So the challenge that we're trying to help address with our social impact investment fund is just how constrained we are on the tax credit investment side. There's only so much out there, and there's people willing to do it, so it's a relatively healthy marketplace. So there's not enough things really in some ways on the tax credit side to invest in, and so that's why we created our social impact investment fund, so that we can continue to deploy, over the next few years, hundreds of millions of dollars outside of the tax credit format.
Great. Thanks, Andy. Kelly, any thoughts on that question?
Yeah, thanks, Scott. I would echo a lot of what Andy said in terms of, some of the hurdles internally, and focused on this, this strategy of tax credits investments. Aetna was very comfortable making these decisions for a long period of time, so it was a little bit of a learning curve, when the companies combined, to really have CVS kind of buy into this and basically increase the amount of investments that we were making. And so really it was about, showing the value proposition of doing these, really to support all of our company initiatives and goals. So, once the CRS team and senior leadership realized how important these investments are in the community, they certainly got on board, and everyone, as I mentioned, across the company became focused on sort of how can we get involved. It only makes sense to bring together everything we're doing across this organization to these properties to really further accomplish what we're already doing there. So I guess another challenge would be, as Andy had said before, a lot of the company works in silos. So it's really finding the path of being able to bring all of these forces together and be doing the same thing together in a community, and making sure that your grants and donations, are your business spend is aligning with your investment spend and all of that to really move the needle, and that's what we're trying to do here. In terms of federal regulations, it's more like for me, because I sit in investment management, it's looking at potential risks and benefits coming out of legislation in Washington. Is it a housing-friendly administration? The continuance of subsidy, programs, favorable or unfavorable LIHTC industry regulations. So, it's keeping a focus on that, and depending on where you think the direction is going to head, can make you change some of your thoughts about your program.
Super. Thank you, Kelly. And Amy, any thoughts on that question?
Yes. So I would just echo everything that the two before me have said, but I would also add that as we focus on housing investment, the whole world of housing is a pretty complex world, and so we can make progress into helping a community create more affordable units and to really be able to close the gap in housing units that are available to individuals, especially extremely low or low income. But the truth is, when we think about our Medicaid population and especially our traditional TANF population of a mom who has a baby and maybe other children in the home, the truth is that a mom with a child that's needing daycare services needs to make about $27 an hour before she can truly afford a 2-bedroom apartment, even in the very affordable areas of Ohio and Indiana. And that's a long way away for a lot of our moms. And so one of the opportunities that we see, not really a barrier, but an opportunity that we see, is how do we start having all of these conversations and seeing it in a broader view, that we don't necessarily, kind of position housing development in contrast to more vouchers within community, but that we need both. And that we don't position a Medicaid budget against a housing budget. We need both. And how can they work parallel together to really be able to respond to the needs of the other? One of the listeners asked a question about HHS and HUD. And I think that goes right to the point, is that even at the federal level, there seems to be very little coordination between the two. I really hope that changes under this administration. Now we see more coordination in the regulation and just the ways that the two agencies can interact with each other, meaning that the on-the-ground groups, public housing authorities, and MCOs, or MCOs and affordable housing developers, that we all can kind of come together to really address and tackle problems so that we can truly move the needle.
Yeah, and Scott, if I could just add to that, and hopefully this is a good thing, Scott, but I'm realizing we're talking more about opportunities than some of the challenges. But I would say that I'm doing actually quite a bit of work with a number of the key national housing organizations, National Alliance to End Homelessness, National Low Income Housing Coalition, the Action Coalition, and some others that we're now very engaged with. And one of the areas that I'm trying to push internally, and then with a lot of the housing community now, is thinking about, the potential for developing a housing and health program at the federal level that would be akin to HUD-VASH, which is the VA supportive housing program that pairs rental assistance from HUD for vets with the services that they get from the VA. They're just to be candid, the political will side is way on the side of the veterans, so that program has been funded pretty well. There's no reason why you could not create a comparable program that paired rental assistance with Medicaid services and for complex care individuals. So that's one of the kind of big opportunities that I'm looking at as we go into this administration.
Great. Thanks, Andy. Yeah, and you're right. It is probably, and sometimes it's a thin line between challenges and opportunities. So in some ways, you're right, though. I think we're pivoting towards that. We've had a lot of questions that have come in. I think that's indicative of just folks' interest in this topic. So I think we'll maybe pivot to some of the questions that have come in. And again, I encourage people to continue to send in questions. I'm going to pick off a few and ask you guys to comment on them. And I might also just mention as I do that if we're not able to get to all the questions that have come in, we'll be producing a question and answer document where we'll go through and take the questions that weren't addressed and even take those that were addressed and get them down in written form. We'll share those out with participants on the webinar today. So don't panic if your question isn't gotten to. One that I'm going to start with that a couple of you have already referenced and I think is a really great one is what would the presenters tell the incoming heads of Health and Human Services and HUD about what's needed to allow these types of investments to continue to grow? I'll just open the floor for whoever wants to chime in on that question.
So Scott, this is Kelly. I was thinking about that. I saw the question. It's a great question. I think, one of the things that has already happened recently was the passing of legislation to stabilize what's known as a 4% tax credit program. So these were, LIHTC investments that basically had some other form of municipal funding associated with them, and they had a sliding scale in terms of how much tax credit equity would be awarded. And so it pretty much increased 25 to 30% bigger amount of tax credit equity into all of these, different types of developments across the country. So, in terms of supply, that just greatly increased the supply of availability of, tax credit dollars. So it'll be interesting to see sort of how that happens. I think it's a great win for the industry, and that, a lot of the nonprofits, if more tax credit equity is put in, then, nonprofits and others and housing authorities will be able to, save some of the soft funds that they've put in and redirect them within their communities. And in terms of, I think we've already touched on what we would say is it seems like, and I'm not any expert in the Medicaid space at all, but it seems like there is more and more that's being talked about being covered under Medicaid, and to really look at all of the gaps that exist in somebody that's struggling with housing stability. Once you're giving them that, to make sure that you are being able to cover all of their needs. That's what I would say.
Yeah, and this is Andy. I mean, I think I would probably say 4 things now. Sorry, one relates to what you just said. I think that's right. I think additional guidance from CMS on where, right, recognizing that at least currently there's been a pretty clear red line about not paying for kind of ongoing rental assistance with Medicaid dollars. Okay, that's fine. But then what are some of the other kind of social determinant of health types things, community and social services that maybe we could make billable, that are, I can tell you in my experience, kind of the glue that makes this stuff work is a lot of things that don't fit into the rubric of a particular code or something. So I think that on the CMS side. I think on the HUD side, I would say 3 things. One is I'm going to be certainly pushing like heck on this notion of a program for complex care individuals and families that pairs rental assistance with services. We have the 811 program right now, but that has a lot of challenges to it, and I think there's other ways that we can get there. Secondly, I would say being very strategic and focusing as they're deploying the additional CARES dollars and other pandemic relief funding. There's another $25 billion on the table, and so ensuring that if you do that, we are providing rental assistance and arrears to kind of the individuals and families that need it most, and then I would say investing and expanding the Section 8 Housing Choice Voucher Program. I think we had mentioned, a number of the places where we are investing in low-income housing tax credits. Those developments serve low-income individuals, but in order for those projects to serve homeless individuals or families or extremely ELI, extremely low-income individuals, more often than not, you need to pair some sort of subsidy, like a Section 8 Housing Choice Voucher, and we need a lot more of that because we need more kind of quote-unquote tenant-based rental assistance that should go to the public housing agencies to get more folks off the waiting list for tenant-based vouchers. But also then as we have more vouchers and we use them in a quote-unquote project-based setting, it enables some of the housing that we might invest in or that others are investing in. It enables them to serve kind of more low-income and more acute care individuals and families.
And this is Amy. I'm just going to add on to that. And first, I'm going to say yes, 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 yes. I agree with all of those things, and those are big lifts that have to be done. And just to highlight a couple of points there, CMS has been pretty strict on the denying the ability for MCOs to be able to pay ongoing rental assistance. And we have more and more statistics and research that is coming out showing that rental assistance does help reduce NICU utilization, homelessness, recidivism to prison, all kinds of different impacts on a person's life. And those experiences are extremely expensive to the state and to many other funding sources. And so if we're talking about NICU utilization, you're talking about hundreds, if not thousands of dollars a day for a baby to be in a NICU, but we can't pay $800 for mom to have a 2-bedroom apartment, or $2,000 a month for an individual to be incarcerated, but we can't help them get a studio or a basic apartment within community upon their release. So if those are the trade-offs we're willing to make, then that's a consideration that we as kind of communities should come to terms with and accept. But if those aren't the trade-offs we're, willing to accept, then, easing up on those restrictions, especially in the beginning and maybe very reserved kind of ways, I think is imperative. Like, we have to start being able to move that forward a little bit. The other part to that is just the extreme need to be able to build more housing. And so if that is expanding the low-income housing tax credit, stabilizing the 4% tax credit, any of those tools, whether it's national housing trust funds, statewide trust funds, local trust funds, those all can help to increase the production and preservation of housing also. But they're, in the mini market, the 4% housing tax credit is, the bond market is incredibly underutilized. And so there have been examples of where states have basically put out a playbook and explained to different investors how they could participate in this program. And through those playbooks, they were able to really intensify the work that was done. So once again, that could be led at a federal level, that could, have some type of support from the federal level to different states, especially ones that raise their hand and say, yeah, we really want to utilize this. We really want to max it out. Can you come help us to do that, to make it as effective as possible? And Andy mentioned the VASH program earlier, the program that helped to end veterans' homelessness. And so we know that there are models at the national level that work, that whether it be the U.S. Interagency Council on Homelessness, what they have tackled throughout their time, there are models. How do we bring Health and Human Services to the table with HUD and come up with those similar type programs that then can be embedded in communities that a mayor, a governor, whoever it is, can really latch onto and commit to within their area and make it work. And then, we as MCOs, our corporate responsibility, our community responsibility is to figure out how we can contribute and support those efforts to take them to scale or to just really help them have what they need to function to the highest extent possible.
Fantastic. That's really great, guys. We're just about at the top of the hour, and I want to be I think to get into another question, unfortunately, we probably aren't going to have quite enough time to do that. But I want to let folks on the line know that we will be taking all your great questions. We'll be forming them into a Q&A document that we'll send out to folks. So don't worry, we will get you answers to your questions. Just a lot of interest in the initiatives that you all are undertaking, and some pretty interesting and nuanced questions that I want to make sure we give ample thought to. I want to thank our three presenters today for really great presentations and spending time to talk about the work that they're doing and some of the ways in which they came to be doing this work. And also want to thank everybody who joined today's webinar. We appreciate your active engagement and your interest in this topic, as well as the questions that you've sent in. At the top of the presentation, again, we have the Medicaid Managed Care Organization website that you can go to if you want more information. And I think with that, we will close today's webinar and thank everybody for your participation. Have a great day, everyone.
Thanks so much, Scott and Jean. Take care.
Yeah, thank you so much. Really appreciate it.